How do you
Yeah.
think COVID played into it growing even more?
Well, let's say Brooklyn, for example, my family's up in Connecticut, but in Brooklyn here, my patients, I mean, some of them didn't leave an apartment for 2 years. So being home, not going to school, not socializing, I think the increase in screen time, so not moving, so we then changed our whole approach. Instead of this top 10 list of eat fruits and vegetables and drink water and those kind of things, we looked at really like blue zones and say, okay, why are those guys healthy? So why is it Greece or Italy or Japan? Certain there's 5 places in the world where they live to over 100. We have the most, the highest percentage of people over 100. And we try to say, okay, what made them successful? And number one, they just don't eat a lot of additives and chemicals and all those things in their foods, and they've been eating the same food for hundreds of years. Number two, they move, so movement is just part of their daily routine. It's not just playing a sport. And then they're part of a community and part of something bigger than themselves. And then when you can do 1 through 3, then you have your purpose in life. And when you're sitting in your apartment not doing things for 2 years, they really lacked purpose, and I think that affected the kids, not just physically, but in a whole emotional level, and we realized there's more to school than just the learning part. There's a whole socialization part that a lot of kids missed out, and, I think that's from babies to elderly, everybody was super affected, because as humans, like, we're social active creatures, and locking us up, not being social, not being active has really affected the kids.